Genesis House and the Friends in Recovery podcast are proud to bring you Answering the Call, the First Responder podcast. Join your hosts, Mike the Podfather and Jersey Ed, as they address the real issues in health and wellness for first responders. From physical and mental health to relationships and work-life balance, we leave no stone unturned. Answering the Call, the First Responder podcast is available on Facebook, Podbean, iTunes, and YouTube, as well as iHeartRadio. 24 hours a day, 7 days a week. Now, here are your friends in recovery answering the call.
Hey, everybody. Welcome to Answering the Call, the First Responders podcast. I am the Podfather, Mike Miles, here with
Jersey Ed, stuck in his garage again, everybody.
in his garage, right where you belong. And producer extraordinaire,
Sweet.
Sweet's the sweet man.
That's right.
Nobody knows what he looks like. Hey, Sweet's got some new equipment today, J.E., and it's a camera that can focus right on him. So maybe, just maybe, he said maybe,
Yeah.
we might get a glimpse of him. We're going to do it in pieces, like just the forehead.
I agree with that. I say we do a cartoon of him.
Yeah, well, you know what I can do is I can point the camera at myself, right? And then in post-production, I can put different characters up in front of my face, or I can blur my face out so people can't actually tell, but I'll be on screen.
This is you.
That is pretty close, actually. That's not bad.
Remember the dude on Tool Time?
Yes. Yeah.
Wilson?
Wilson, yeah.
Yeah. You'd be Wilson.
Yeah.
That's awesome.
Hey, guys, real quick, I want to tell you who our guest is today. We're going to bring her on in a little bit. Jillian Bailey, she's a nurse from New Jersey. With everything going on, guys, with all this COVID shit and everything, Podfather, I admire everything you do. You're my first responder, my first responder. But these nurses now are definitely our first responders.
Heroes, baby, heroes.
Yes, and the doctors and everybody. And so we're gonna have a nurse, Jillian Bailey, on in a little bit. We're gonna talk to her, maybe how she's dealing with it, and maybe some of her coworkers and all that good stuff. So
Yeah, she has a real serious job. It sounds like she works in
Yeah.
a very tough environment.
Yeah. So back to the picture of you, Sweets. Let's get
Yeah.
That's good. That's
I mean, I would say the beard is a little off.
Yeah.
It's not that long anymore. I did trim it down, but everything else is,
the mustache.
yeah, the mustache
There you
is right
go.
because
There
it's
you go.
straight
That's
across
even
my
better.
face.
Did
It
you
goes,
go to art school? Would you go to the Philadelphia
did.
School of Art?
yeah, my mustache does go from ear to ear.
It does.
Full
When he-
length mustache.
When he waxes it.
Yeah, I shave it that way. I shave it straight across my face.
That's right. And you know what? He's got on high heels today. I think he's
Again, always. Oh, it's for you because you're the one that likes them.
You look good. You're looking
Yeah.
good.
Thank God I'm not in that
So-
studio there.
So Jersey Ed doesn't look stuck down in Jersey. He
No,
looks like he's doing fine. He's smoking a
Cigar.
cigar, eating pizza, playing on video,
Drinking a $3 drink.
time away from the wife and the kids.
That's right.
Yeah. You don't look like you're stuck at all. You look like you're doing just fine.
You're in a real man cave.
Yeah,
What's that bike hanging
Yeah.
over your head? What's that about?
That's it.
that's for show.
I can't imagine you on a bike.
He
It's
runs.
It's hard to ride it that way. It's hard to sit on the ground like that. So
Yeah.
What's that ribbon for? Not eating carbs?
no, that ribbon. In second place in an auto show with my Corvette I used to have.
Oh, I remember the Corvette. He had some nice cars.
Yeah.
I didn't realize what a wealthy man he was. till I
Are
went
you
to visit him.
are you sitting where the Corvette used to be?
I am.
Oh wow.
I
Sad.
am.
The guy's
sad.
got cars. He has so many cars, he has to keep them at private places.
At his different houses?
I'm serious. Yeah, it's crazy. I went down. I thought I was with
Which house? Which house are you at? I'm at the Corvette house.
Yeah.
Which house?
What was the old car you had, Eddie?
1950 Buick Special.
What a beauty that was.
That was a fun car. That was
a beautiful car.
yeah. I enjoyed them all.
I bet.
So when you look out your window, do you see people walking around?
I do.
Really?
Really?
Yes.
How do you feel about that?
I don't know. I see police officers driving. We have a cop that drives around on a bike here,
Mhm.
a bike cop,
Yeah.
patrolling the neighborhood. It's very serene up here and quiet and just peaceful. How about you guys up there?
Yeah, there's people
Yeah,
out walking
people
around.
out.
I know there's some of the towns came up. Beverly came up with a city ordinance to for if you're out walking on the sidewalk that you have to walk facing traffic,
Mhm.
and you all have to walk on the same side of the sidewalk, and you have to be a certain distance apart.
Yeah, I've all mine here.
Yeah. Well, I mean, I saw an article the other day that said, if you're walking near people or running near people, that the heavy breathing and coughing and all the spittle that comes out, like as you're supposedly running past them,
Right.
you're basically running into a cloud
A
of
big
whatever they
ball
were
of
just
spit.
breathing.
Yeah.
And, so there's like, I go out and run right now.
Yeah.
And, I run at a track and there's people. So
Sure.
now I'm going to take extra precaution. They're like 10 meters
I know.
behind them and
Stay
to the
away.
side.
Right.
And so, I mean, it's
Fucking Canada Sweets.
what's that? 10 meters. Well, that's how they said it in the article. I don't know. I don't even know what 10 meters is. I'm just going to take a stab at it and hope for the best.
10 meters, a little less than 10
How do you do that in
yards.
empirical numbers? Like, what is that? Is that
Hey, I heard on
15 feet?
the radio this morning, a guy in New York was arrested. Him and his 6-year-old daughter were in a park, and they were, just playing catch. And this was Monday, and the police arrested him for violating the ordinance.
That's.
I mean, I think it's a bit much. I really do. I mean, if you're breathing heavy on somebody, or you're violating somebody's private space. Hey, I'm the type of guy that when I'm in a market, if somebody's behind me and they're up my ass with a carriage, that pisses me off. So what I do is I pull my carriage when I get in line, so nobody can get behind me. It makes people crazy.
I bet.
They want me to put that bar down on the conveyor belt and start putting my stuff. So I do, but unfortunately for them, they can't get to it. It makes them crazy.
Leave the cart right
I've had people say things to me.
Yeah.
How come you have the car? Why don't you? I say,
Hey, Podfather, when I'm going to where, like you guys are talking about running, I run on this tow path in Pennsylvania, and it's a real small tow path. That was one of the things I was thinking of, man. Am I running past these people, or they're passing me, and am I breathing this shit in?
Right.
Well, that's what the article I read said, that you got to be wary of the fact that you're basically running into a cloud of their breath.
No, that's what I'm afraid of. But here's the other thing. So every time I go down there, and this is a first responders question. So every time I go down there, in the middle of the road, they have a parked unmanned police car.
Yeah.
What's the deal with that?
Well, it's a visual, and basically it's just to remind people that there's a police presence. Believe me, there's been studies. The Department of Justice have done studies on these cruisers that are police cars, whatever you want to call them, that are parked with unmanned, and believe it or not, they prevent crime at a high rate.
Really?
I got a funny story. We had a van. We had this $300,000 van in Lowell. It was pretty close to that. The citizens of Lowell chipped in and bought this beautiful police van. It was like it can be used for many things, but people toured it and they loved it, and we'd park at different places, and it would be running all the time. And it had all kinds of camera. You would have loved it, Sweets, because it had all that camera stuff,
like a podcast studio on wheels.
And somebody sliced the tires. Yeah, someone sliced the tires and somebody else spray painted on it. And whether they caught him or not, I'm not sure. But yeah, that's all that is, Eddie. That's just to keep people in the mindset that there are the police presence and do the right thing.
Okay, all right. Well, I take it as saying that it's a little town that I drive into, and I just take it saying that we're here for you. That's how I take it. So
sure, that too.
This time, because they're not pulling anybody over, I'm guessing. So
well, you have a lot of experience running from police cruisers, don't you?
I have.
Many years ago.
Yes.
Fast Eddie. They used to call him Fast Eddie.
Now
Yeah.
they call him Jersey Ed. So yeah.
Jersey Ed.
Now he just keeps running. He's practicing just in case.
No,
you never know.
He is a good.
You probably get away now, right?
Nah, probably not.
No.
I don't know. I can probably outrun them in the long run. If they want to do like a 10-mile chase, I could probably end up beating them in 10 miles.
Get him on the distance, right?
You met my friend Tom Fleming, right?
Yeah.
So Tom Fleming is a runner, and he's a power runner. I mean,
he's a big guy.
Yeah, and he can run. And I mean, so I remember working with him, and somebody would run, and I'd be yelling at them as he was getting out of the cruiser.
Yeah.
Good luck. Give up now.
Yeah.
He'd chase him. He'd go forever.
Yeah.
He never lost anybody. It's the best, I swear.
That's good. Well, you know what, guys?
Let's bring on our guest.
Yeah, Jillian Bailey. She can answer some of these questions for us, we think. And that's the other thing I want to get into the nurse's mind, too, because I think everybody thinks that the nurses know everything and see all and all that. And maybe she can kind of answer some of these questions. So Jillian Bailey is a nurse from New Jersey, currently working at a detox rehab facility in Sussex, New Jersey. She has nursing experience in psych and hospice. And it says, I don't know what this is, but sent from my iPhone. I don't know if that means anything, but I'm just kidding. But Jillian, welcome to the show.
Hi, Jillian.
Hi, everyone.
How you doing?
I'm good today. How are you?
Good, good, good. So you have all the answers for us because you're a nurse, correct? Or is that a lot of pressure you hear all the time?
Yeah. Being a first responder of any kind, I know people come to you very often or come to me very often with questions and all kinds of questions. And, I know what I know, but I don't know everything. And it is our job to educate and to guide as much as we can based on our knowledge, but it's definitely not possible, to answer every question all the time.
Yeah, that's a tough one.
So I have a question. I love your Irish name. It's a very nice name, both of them. And actually, one of my daughters was going to be named Bailey. We didn't name her Bailey, but we almost did.
Good choice.
She got the name Cara instead, but pretty close. No, but you're working at Detox, is that correct?
Yes.
So I mean, you're working with people that are pretty much trying to, restart their lives and get their lives back on track. And there must be tons of stress. And I mean, talk about questions. You must, it's not like working in a nursing home where everything's kind of mundane. I mean, you must see a lot of stuff.
Yeah. Part of the challenge of working at a detox and a rehab facility is, as a nurse, you want to provide the best quality care at all times. And the scope of nursing practice in a detox and rehab facility goes beyond the physical care. Just kind of, I feel like that's what you're talking about here. A lot of our patients, once they pass the phase of detox, acute detox, 5 days, 7 days, depending on what's going on with them, most of them are stable, pretty much physically, medically stable. So we do work a lot with other questions, how am I going to rebuild my life? Emotional problems, mental problems, all kinds of things. And one thing that makes it difficult is not being able to fix that for a patient. It's very easy for a patient to have a fever and then you give them Tylenol and you're fixing it. You're not curing it, but there's
Temporary relief.
Yeah, there's an intervention that a go-to intervention. And so, it is very challenging, but it's also very incredibly rewarding. Oh, it's incredibly rewarding. And it's more facilitating.
Did you always want to be a nurse as a young girl? Did you think this was what you were going to do?
I always knew I wanted to work in healthcare and in a hospital, which I don't technically work in a hospital right now, but my grandfather growing up, I was very close to my grandparents, and my grandfather was just very often in and out of the hospital with congestive heart failure. He was diabetic. He had a lot going on. He was legally blind. And every time he went to the hospital, very sick, he would eventually return in good health.
Right.
And so for me, the hospital was a place that made people better. And
great analogy. Wow, that's awesome. Yeah. Very touching.
Well, back to the statement that you were saying, detox versus a nursing detox versus a hospital. They're there for that specific reason. You fix it and you give them some kind of plan of action, and they're on the road to recovery. But Mike and I, being in recovery, we know when you probably see this at work, when somebody's detoxing, they feel much better at the end of it, and they're like, fuck it, I'm done with this and I want to get out of here. So as a first responder, you have to tell them, no, this is not how it goes. There's another step to this, and I never thought of a nurse. We have a nurse at Genesis House. I never thought of a nurse as a first responder at a treatment center. It's true, you are. I mean, you're on the front line helping these people basically stay alive from whatever substance they were using, and getting them to the next phase is where the therapist can get a hold of them. That's where the mental work comes. You do all the physical work with them, getting their bodies off of it. But I guess and I know from me, when I quit drinking, I know that I was done after 3 days. I said, oh, this is cool. I can do this now. But that's not true.
Right. No, I have a lot of patients, especially, well, what I see the most is I see patients that feel like, all right, I'm great. I'm ready to go. I'm done with this. I'm physically feeling a little bit better, and the drink or the drug is removed from me. So I'm good, right? I'm cured. But I think I mostly see patients who really are struggling with it and kind of don't want to go through with it, to be honest. They know that it's going to be difficult and they don't really want to stay or continue treatment for that reason. I see both, like I said, but especially a lot of the younger people too, they feel invincible. I think that's normal in youth, right?
Right. I agree. Yep.
And so they feel like, I can do this on my own. I don't need to stay here. Maybe they don't feel like they fit into the community because addiction doesn't discriminate, right? So it's all kinds of people, all ages, all together in this room. And that definitely is part of the challenge, trying to talk to patients and kind of walk them through it. And try to stay present. They're making all these grand plans,
Right.
or grand fears, right? Or anxiety.
Right.
And we do try at my facility, to incorporate the 12-step philosophy, tell them focus on today, focus on right now, bring their attention back to themselves and
Keep it in the day.
yeah.
So, I'm sorry. No, so a lot of people, would you say the majority of people detoxing from, let's use opioids and fentanyl, do they try to AMA or do they AMA? See that smile. Yeah.
I also wanted to say what you were saying before, Ed, as far as when I mentioned they either want to just leave, we also try to tell them this too shall pass, which is another 12-step thing. But do they want to AMA? Yes. Majority, I would say majority, not all of our patients at least go through a phase where they're ready to leave. They don't want to do this anymore. They either feel like they can't take it and they can't go forward, or start prioritizing other things other than themselves and their sobriety and their recovery, which is kind of also what I wanted to touch on today, how it's important for everyone, people in recovery, people in, the healthcare field, all first responders. If we don't take care of ourselves first, if we don't put the oxygen mask on us first,
right,
we can't do anything really. And this is something that we try to reinforce when they're feeling that way, when they go through that, I want to leave, I got to get out of here. And we have a lot of patients that do leave, and we're on a hill, so it's kind of in the middle of nowhere where I am, and they'll go down that hill, they'll go out to the middle of nowhere. We have a lot of patients that come right back.
They do, huh? That's awesome. Yeah.
No, that's awesome. No, it's not good that they leave, Mike.
No, it's awesome that they come back.
I mean, not a lot of them, but a lot of them that do leave, eventually we see them again,
Sure.
Okay, I misunderstood you. I'm not.
So I had a friend.
Garage, Mike. Come on, give me a break.
I had a friend who went to a facility. I talked him into going, and it was in New Hampshire, and he got up there, and he ended up calling me at 2 a.m. from the nurse's station, and calling me all kinds of bad names. And I better get up there and pick him up, because he was in the middle of nowhere. And that's just what he did, Jillian, just what you said. He left, he went out, he looked left, he looked right. There wasn't anything around for 3 miles either way, but woods, owls hooting, maybe coyotes. And he went back in and said, all right, I'll stay one more night. And he ended up he's been sober 29 years.
Wow.
So yeah, so we had success, but that's a good story. So right now, currently, you're working, I'm sure. It's got to be so hard for all of you, medical providers and stuff. It's got to be difficult. Tell us about it.
Well, hold on to that thought. We're going to take a break here real quick. We'll come back and we'll get your thoughts on how hard it is to be a nurse nowadays in a hospital. We know you're not in a hospital, but we'll talk about that. So, Podfather, back to you.
Okay, Answering the Call podcast for first responders. We'll be right back.
Since 1992, Genesis House has been helping real people heal from addiction on their private recovery campus in beautiful Palm Beach County, Florida. Their family-owned program is accredited by the Joint Commission and offers detox and dual diagnosis treatment in a comfortable and confidential setting. The First Responder Recovery Program at Genesis House is led by a doctorate-level therapist with direct professional experience as a first responder himself. Treatment modalities focus on psychiatric care, relapse prevention, stress management, and trauma-informed care for PTSD. Learn why their individualized approach makes a difference for first responders. Call Genesis House today at 1-800-737-0933 to speak with someone who understands. Visit them on the web at www.genesishouse.net. It's time to start your journey to a long and successful recovery.
Hey, everybody. Welcome back. Answering the call, the First Responders Podcast. I am the Podfather, and I'm proud of myself.
You did it. You got it right.
I got it right.
See, if there's no pressure, he just kills it.
No pressure. I'm here with Jersey Ed.
Jersey Ed here in Langhorne, Pennsylvania. Don't ever retire, Podfather, because nobody can do your job the way you do it anyway.
That's a good point. You're right. You're right. And we got Sweets on the microphone over there.
On the equipment in the background.
Sweets has been lifting. He's doing all kinds of stuff.
He's just lifting a stove, he said.
Yeah.
Yeah, he's lifting the stove. He's got on a nice pair of yoga pants.
Yeah. I'm sitting over here. I'm looking at these hydrating face masks that you got me earlier, Podfather.
Yes.
I'm really excited.
Sweets and I, as Miss Meg told us about these facial what are they?
They're peel-off masks.
Yeah.
Throw it over there. I want to see it.
So I used one last night. I look 10 years younger.
The fuck?
There it is.
Oh, God.
They sell them at Target.
Yeah.
Like a face mask,
peel off face mask. I'm actually looking for. I'm gonna do this after the show.
I bought two because I have a huge forehead.
I'll go get wrapped up in a blanket on the in the living room, and I'm gonna put on a face mask and scare the dogs.
Yeah.
Listen, guys, I don't think the first responders want to hear this. They might want to hear Jersey Ed's podcast pick of the week.
Yes,
they definitely would rather hear that.
Let's hope it's a little more manly than the mask that we're throwing around.
Yeah.
The Sweets, hit us with a drum roll there. Thank you. And the Jersey Ed's podcast of the week is, get another one in there, thanks, and is the Healthcare Professionals in Recovery. Hosts Sean Fogler and William Knuckle, I think it is. The Healthcare Professionals in Recovery show is a podcast designed for healthcare practitioners interested in caring for patients with substance abuse disorders and those in recovery and harm reduction. And of course, you can find Healthcare Professionals in Recovery podcasts where you get all your podcasts, from. Also, if you have any questions for Jillian or the Podfather or Sweets and myself, you want to call us at, again, Podfather, you got it?
Right here, 617-379-1163. 617-379-1163. And I just want to say, it's coincidental. We got this new phone number several weeks ago. And 163 was my badge number for 35 years. So it's almost like a sign, I think.
Right, that's right.
So I'm going to call it.
You give a call to it. And also, you won't hear any of us three on that. You'll get Miss Meg answering the call for you. So
she also gives beauty tips.
She does. Yes, Miss Meg does. Absolutely, she does. So so we're here with a nurse from New Jersey, Jillian Bailey. And we were just discussing a couple things and how her career path is and what she's doing, and hopefully she'll give us the answer for COVID-19 at the end of this show. I'm just kidding, everybody.
So Julian, at work now, I mean, how different is it compared to a month ago?
So I'm glad you brought this up. I have some friends that are in the nursing community, not necessarily just at my job where I work, but in general, the general consensus seems to be pretty high anxiety. Not everyone, but in general, this is a stressful time, and a lot of people are concerned about protective equipment, making sure they have some places they're reusing it. Other people are concerned about coming home and being with families. But me in particular, this is actually something that I had a few weeks ago, about 3 weeks ago, was the last time I worked at my facility, at the facility I work at. And the reason is because when I went in there, this was still kind of new, and I didn't feel like our facility was taking all precautions that they could have been. And we're still accepting patients off planes. We didn't have the proper equipment to protect ourselves, among some other things. So what I had to do at that time was I had to sit back and ask myself, after going to work, feeling uncomfortable, feeling a little bit unsafe in the position that I was working in so closely with all the patients and in a community setting. I had to step back and I had to say, how can I best serve my community in this scenario? Like, what is my part in this? And sometimes it's hard, I feel, to practice self-care when our identity is linked to a professional caretaker role or a professional service role for the community. But I also believe that it's very important to maintain our own safety and self-care. Mm-hmm. And so I am per diem right now. So I'm also lucky that I get to dictate my schedule. And based on that assessment, I felt that it's better at this time for me, instead of being here where I feel uncomfortable or unsafe, I could better serve the community in other ways. And I felt that my part at this time was to be home. Since then, I have moved, so I'm an hour and 45 minutes away, and I'm looking for something local. And I think I'll be looking into, probably, they're opening a lot of pop-up COVID testing centers around here. And I feel that I would be more useful in that setting. I feel like going somewhere where I don't necessarily feel so safe because we don't have proper equipment. We're still accepting patients. We're in a small, close setting, versus being in a COVID center where we have the proper equipment. We're actually making efforts towards making a difference in this. For me at this time, I think is more appropriate. And that's something that took some time for me to think about and work on, mm-hmm. But I think that's what I wound up doing.
Good for you. That's well, you put that in a real understandable fashion. That's good for you. Good. Very smart move.
Decision for somebody to make that
must have been difficult. Yeah.
We're all in the healthcare field too. And, there's times that I answer the phone that, we're out to dinner or whatever and helping patients do what they, get wherever. But that's a great decision to like you said, putting your mask on first and then taking care of what you can take care of. And to step into that COVID testing center is probably scary, but it's probably a lot safer, sounds like. It is what it is, so.
Yeah, I just feel that it's important for nurses and for all of us, but focusing on me, to perform at my best, right? And so I continuously make an effort as a nurse to provide quality care, to perform to my full potential, to be the best coworker, the best nurse. And I think it's important for me to take certain steps in order to do that. And I think that's something we should all consider in our line of work.
Absolutely. Yeah. Now, how long had you been at that facility for? Quite a while, or?
I was there for about a year.
Yeah, that's a good amount of time. Yeah. Well, it's good to have the credentials that you can just be able to go somewhere and I mean, tough education. I hear a lot of people saying I was going to be a nurse, but it's very, very difficult degree to acquire. I was going to be a nurse, but it's a lot of work. I was going, so I really applaud you. And as a cop who worked in the streets for 28 years, Lowell used to have 3 hospitals, 3 emergency rooms. I can't tell you how many times I was in and out of emergency rooms and emergency situations. And I've always admired the nurses. The doctors are good too, but the nurses are the front line. They'll tell you the truth. They tell you what's up. They give you their time. They're always, to me, always pleasant, professional. I mean, I'm not blowing smoke here, Jillian. I'm just saying that you will, Jillian.
That's so sweet.
That's well, it's so true though, and I saw it firsthand, and yeah, good stuff.
Jillian, what to sum up this? We're gonna have to close here in a couple minutes, but to sum up everything, the COVID, the nurses have the answer. To sum all that up, what do you, and your coworkers, what are you hearing from your coworkers that are saying, are you crazy? Stay away from this. Go back to that detox. I'm sure you're hearing that too, but give us the summary of that.
So to sum it up, I feel like, I'm definitely hearing that, because I have a lot of friends that I know that are nurses that have been working in hospitals and that are either positive or sick, but don't, haven't gotten tested and but I think what it comes back to, all of this, regardless, all of my conversations pretty much come back to, what is my responsibility to myself and to the community as a nurse, as a professional caregiver, and also as a human being. Like, we've kind of discussed there are many roles of each of us, and kind of staying true to each one of those roles. And by staying true and practicing this self-care, I'm better able to perform each one of those roles to the highest potential possible. And I think that during this time with COVID, we all definitely stay in, follow our precautions. I think for the people in the front line, we do the same thing, apply our critical thinking and process to this, just as we do everything else. Use our knowledge, our personal experience, our knowledge from education, go up the chain of command, listen to the experts, and continue to advocate for those around us, encourage them, lead by action. Also, I'm not going out either. I'm a nurse, but I'm not going out because I'm immune to all this. We have to lead by action, not necessarily just what we say. And I think can be available to people for questions, comments, concerns, talking on the phone, giving them education that we know. But at the same time, I think it's very important to distinguish between what our role is and what our role is not, and to be helpful and good to the community and positive is different from unnecessarily putting yourself in danger when you don't have to, unless you so choose.
Right. Wow.
That's amazing.
Great analogy. You're so smart. You're such a bright girl.
Jillian,
Wow.
Bailey, thank you very much. And after all this is out and done and everything, let's get you in and let's hear the good news. We'll bring you back on the show to hear all the good stuff and that COVID
That's awesome.
and you're going to be good to go. So, but Jillian Bailey, thank you very much. A nurse from New Jersey. You are our first responder. We love you guys. Nurses are wonderful. Thank you for doing what you do.
Thank you so much for having me.
Thank you, Julian. You were awesome. And Eddie outdoes himself again. He gets the best guest, I swear. I don't know where you got him from, Ed, but boy,
But
you do a good job.
Podfather, that brings me to a question to you. Hearing Jillian talk about nursing and being on the front line, and I always, from day one, from when I started the show, when I started our first responders program down in Genesis House, I always knew that the nurses were definitely the first responders. So my question to you, Podfather, is how do you see the nurses? Like when you told the story about going into the hospital and the nurses were there, were they like a relief for you if you brought somebody in or if you had a question, or what was a nurse to you when you walked into that hospital with somebody?
Always a wealth of knowledge, a wealth of information. First person you'd see, somebody was arrested or somebody was hurt. I got jumped one night. I got thrown on a fire hydrant. My shoulder was broken. I was in uniform. I ended up at the hospital. And I was in excruciating pain. My arm was facing the other way. I'm 28 years old. I don't know. But, and all I could think of, I never had a scar. I've never had stitches. And here I am with a broken shoulder. And this nurse came over. She was an older woman. And she put her hand on my hip. And she said, "We're going to give you a shot to help you with the pain." And she just was so comforting to me. And everything she said, they did. And that's what I got firsthand. Not because I was a cop or I was in uniform or anything. It was just her empathy and understanding of the pain I was in. And she led me through everything, the x-ray, what happened to my arm, what I needed to do. Of course, after they gave me a shot, I think it was Demerol. I don't know. It was after I got the shot, I was in heaven. The pain went, I felt good. But as a cop and going in a very tense situation with rape victims, with victims of domestic abuse or just plain physical abuse, babies choking, anything, they were always the front line. When you say first responder, You're 100% right, Ed. I never thought of it that way until I've been watching the news. I watch these people every night, 7 o'clock in New York, hanging out their windows, applauding all the nurses and doctors coming out of the hospital. And doctors make good dough. We know that. But they as well, they work their asses off. Some of them work 20-hour days, and that's like normal for them. It's amazing. And someone said to me once, my doctor's kind of cranky. And I thought, I know why your doctor's cranky. They never sleep. They're always working. Nurses the same way. I'm sure Jillian's been forced to work overtime when things happen. Sometimes you just don't have a control of it. I mean, look how smart she is. She's a very intelligent girl. She answers our questions in a way that very methodical. She puts a lot of thought into it. And these are the type of people that you're going to entrust your children to. Yeah. You're going to entrust your loved ones, yourself. I have nothing but high praise and respect.
Yeah, absolutely. We want to hear from our listeners out there about nurses, and come on, guys, get on the phone, start calling and email us. help@friendsinrecoverypodcast.com. Give us a call at that, or give us a call at give us an email there, or 617-379-1163. Let us know how you guys feel about the nurses and doctors doing what they're doing, and especially from the first responders, the police, the fire, everybody along those lines. Let's give a little praise to these nurses out there.
Absolutely. And I know all my brother and sister officers and firemen and correctional officers, they all know the same thing. EMS even more so, because they're in and out of the hospital more than anybody. And, that's who they go to right away. The first person you see is a nurse. And you know what? They always have an answer. I've never ever gone into a situation, a very tense, serious situation, without somebody having a calm approach to something with all the right information. And I mean, that's what you're looking for. When you're heightened, when you're anxious, when you're not thinking straight, and you have somebody that can comfort you that way. Are you kidding me? That's gold.
Yeah, exactly. Sweets, what's your thought on all this? You're a little quiet over there, but you usually quiet down while the guest is on. And
you know what he did? He put a nurse's uniform on while we were talking. I didn't even see him. Look at him.
Just out of respect.
You're so good.
I got a new picture of you, Sweets.
Oh wow, that's it right there.
Is that it?
It's like you were watching.
Were you watching us?
Yeah.
A little thing for the nurses there.
A little hat. I like it.
So.
I mean, I have to say the same thing the Podfather said, is that, whenever I go to the hospital, the emergency room, I mean, I deal with addicts and alcoholics struggling with addiction all day long, people who are, facing overdose, or they're looking for treatment and stuff like that. And it's exactly right. The nursing staff are the first people that you run into, and it's their demeanor, it's their knowledge, it's their understanding of what's happening, and their calming nature that keeps you engaged and pushes you through the system. And, they usher you to the next step, and that's huge. And, I was listening to some of the decisions that Jillian's had to make, and, in regards to safety and stuff. And right now, with everything that's happening, I mean, my decisions are simple. I have to decide whether or not I stay home or not, because my 70-year-old mother lives with me. That's it. Yeah. And by stay home, I mean, play video games, play with my dogs, and, record podcasts. Those are my big decisions of the day. And, so I'm just overwhelmed with some of the decisions that, nurses and first responders are making right now. Is, should I not go home to my own family? I've seen a couple posts of people that, like, because they're out there, they're at risk. So they're not even going home. They come home just to see their kid through a glass window and say hi, and then they go back and sleep in their car. So it amazes me, the types of decisions they have to make and the decisions they make based on that. Cause I personally don't know if I could.
Yeah. And it's so true. What Jillian said, put your oxygen mask on first. And, right. But sometimes I don't know if these nurses do or these doctors do, because if they were to put their oxygen mask on first, they may not go out there and give the hand that they've been given, and it's just kind of mind-boggling that somebody. I don't think I could do that. I don't. If I was a nurse or a doctor, I don't know. I mean, I just don't know. I probably would make that decision to do it, but I get like crazy, like kind of listening to these stories with these doctors and nurses, and then on top of it, not having the proper equipment, or coming up with something to help them hopefully not get what's going on out there.
Hey, Eddie, when I was a younger cop, we didn't have rubber gloves, we didn't have face shields. I've given mouth to mouth to people, that total strangers. I had a guy that collapsed at a baseball game. a Babe Ruth League baseball game, and he was a grandfather of one of the kids playing. And we were in the cruiser. We just pulled over to watch 5 minutes of the game, and all of a sudden the people are calling us over. So we run over, we climb over the fence. This guy fell dead away, and he was having a heart attack, and he wasn't breathing. He was actually dead. We never revived him. But I had to drop down and start giving him mouth to mouth, and literally mouth on mouth. Now this is, think of that. And my partner was doing the chest. This is old school, the chest compressions, and I'm trying to remember as I'm doing it, how many breaths, how many compressions, does he want to stop pushing and do the mouth? And I knew he didn't. I could tell by the look in his eye. He was afraid I was going to say, you want to swap over, Grandpa had false teeth too, and I had to pop those out. And
Oh my God.
This kid was pushing so hard, the whole Grandpa's body was going up and down. And I said, do you want to swap? And before I got the word swap out, he's saying, no. But that's what we used to do. And that's what they used to do. And I mean, on a regular basis, it wasn't like, I've been to places where someone is choking at a restaurant and someone will say, I'm a nurse. And I just get right out of the way. I keep the crowd back. I say, I'll help. And I've done this at a wedding once, I'm like, well, what can I do? What do you want me to do? And it's a difficult job. And now with the equipment they have nowadays, even with that, I still think it's a very tenuous job.
Yeah. Well, guys, we're almost come to the end of the show here. That was an amazing show. I'm glad we were able to get a nurse, Jillian, on here, because it was amazing to hear some of the stuff. We do work with nurses down at Genesis House, and we see the part of them that's not so great. But I love to hear these stories from the first responders, the great stories. The stories of making decisions at what they have to make, and to every nurse, every doctor, every first responder out there, thank you from the bottom of our hearts here at Genesis House and First Responders, the Answering the Call First Responders podcast. We thank you guys with loving care, and take care of yourselves, please.
Yeah, great show. And I just want to apologize to anybody that's been watching, because I've been on my phone a lot. It is my birthday. Got to give me a pass on this one. I got a lot of friends, family members texting me, and
don't rub it in that you got a lot of friends, man. All right, not all of us have that.
I think they're friends, but hey, thanks to everybody, and great guest, Eddie. Answering the call.
Well, hold on.
Sorry.
I just want to make sure that our
Please.
listeners have access
Absolutely.
to previous episodes and future episodes. If you've stumbled across this and you're like, wow, this is amazing. I love that guy, Jersey Ed, and the Podfather is fantastic. And I mean, oh my God, Sweets.
Like.
If you've stumbled across this, you can jump on our Facebook page, Answering the Call, the First Responder Podcast. You can like, you can share, you can comment. I'm sure the Podfather would love to see some happy birthday comments on there.
Good.
In addition, you can go on YouTube, because these are on video as well. So if you're listening, just know that you can go on and watch. Go on to YouTube, look for Answering the Call, the First Responder Podcast. Make sure you subscribe, turn on your notifications so that you get a little ding on your phone every time a new episode comes up, and then you won't miss them. And of course, if you have questions, or if you'd like to present a topic, or if you'd like to be a guest on the show, what number can they call?
They can call us at 617-379-1163.
Fantastic. And then they can also leave us an email at
help@friendsandrecoverypodcast.com.
And there it is.
What a great voice that Sweets has, huh? I'm so glad that you interrupted and did that, because, I
Just
talk
smooth
fast.
things out, right?
Yeah, you calm it down, you slow it down. My blood pressure went down, and you did a great.
I'll read you some stories later.
Oh, I love this. You're gonna leave the nurse's uniform on?
Oh, yeah.
Oh, wonderful. Hey, Answering the Call, the First Responders Podcast. Thank you, everyone.
Stay safe, everybody.
That concludes this episode of Answering the Call, the First Responder Podcast. Thanks to Genesis House for sponsoring the show and supporting first responders who are struggling with addiction and mental health. Follow us on Facebook for past shows and updates. If you are interested in being a guest on the show, email us at help@friendsandrecoverypodcast.com.